Hi everyone, and welcome to today's educational webinar brought to you by Physician Partners and the Physician Resource Center. My name is Dustin Brown. Before we introduce our presenter, Teresa Propati Gonzalez from Physicians Trust, I'd like to go over just a few notes. One, everybody is muted throughout the webinar just to avoid any background noise. And number two, at the end of the webinar, feel free to type in your questions using the GoToWebinar interface. As they come in, we'll answer them. So to introduce Teresa, she has spent the last 12 years in healthcare. 8 of those years she served as a medical assistant with Scripps and other practices. She is a certified EHR trainer and MU attestation expert working with regional extension centers, IPAs, and health systems. Welcome, Teresa, and thank you for being our presenter today.
Thank you, Dustin. Good afternoon, everyone. Today we're going to go over meaningful use. Today, stage 2 and beyond. We're going to concentrate on where we are now, our important milestones, some stage 1 updates, what you need to do to transition to stage 2. By this time, everyone should know what is meaningful use. It's using certified EHR technology. You're improving quality, safety, and efficiency. You're reducing your healthcare disparities, engaging your patients and their families in their healthcare, and that's going to be a big focus of stage 2. Improving care coordination, improve population and public health, and maintain your privacy and security. All that, and you will get an incentive. Eligible providers. I'm not going to go over this in detail. This will be available. Medicare providers, MD, DO, dental surgeon or dental medicine, podiatry, optometry, and chiropractors. Some important dates to remember. If you are going to attest for a 90-day period, you would have started October 3rd. That is the last start date. That will end December 31st. Also, for those of you that are reporting for calendar year 2013, that will end December 31st. Your next reporting period, stage 1 or stage 2, will be January 1st. Keep in mind, October 1st, 2014, you must have submitted, not start, but submitted your first attestation to CMS to avoid a payment penalty. Again, some information on payment penalties, payment adjustments, very important. If you are a Medicare and a Medicaid provider, if you are eligible for both programs, you must demonstrate meaningful use according to the timelines in the previous slides. You do not want to miss a year as you could for Medicaid if you are also a Medicare provider. Okay, that's very important. There are some hardships that are available if you don't have internet available, if your provider is too new to be able to meet meaningful use, if there was a natural disaster in your area, if your provider does not do face-to-face, or if you have multiple locations and you don't have availability of an EHR for more than 50% of your encounters. Again, the timeline, I do have a link. We're not going to go over this so much on the amount that you're going to get paid, because I really want to spend some extra time on discussing what stage 2 is going to mean to you and your document requirements. Right here is a very good tool for seeing your participation timeline. And there's a link at the bottom, and at the end of this program, Dustin will be sending it out. You can go on this site and it'll tell you exactly how much money you can expect to get for incentive and what years you're going to be attesting for stage 1, 2, or 3. New criteria. 2014 is when stage 2 will start if you have done at least 2 years of stage 1. If you are just starting stage 1 this year, then that means that you're going to continue with stage 1 for next year. Once again, improving patient care. Stage 2 is huge on this. That's going to involve setting up your patient portal, making more things accessible to your patients. The whole goal is saving money, saving times, and saving lives. We're going to review some of the changes from stage 1 to stage 2. You're going to go from 15 core objectives to 17 core objectives. Instead of 5 out of 10 menus, we're going 3 out of 6. You're still going to have a total of 20. Once again, first year of meaningful use plus 2 years equals stage 2. So providers that started in 2011, that means that you are providers that will meet 3 consecutive years of meaningful use stage 1. Stage 2 or 2014 stage 1 reporting is going to be 3 months, regardless of what stage you are in. Very important, if you are Medicare, it is going to be on the quarter. If you are Medicaid, it is any 90 days consecutive. Stage 1 objectives are now core objectives, and all of the thresholds have been increased. You're going to have secure electronic messaging, providing the patient the ability to view online, download, and transmit their health information within 4 business days of the information being available to the EP. Record an electronic note. Imaging results accessible through your EHR. Now, the last 2, identifying and report cancer cases to the state registry, and the imaging results, those 2 still have to go under stage 2 being updated. So there are going to be exclusions for those if those aren't available. While you can continue to try to get exclusions for menu objectives, 2014 it's going to be harder. Okay, you're going to have to do 9 out of 64 total clinical quality measures. Also remember, starting in 2014, groups can batch report. All right, so at this point, we're going to go through some of the measures and discuss how they have increased. CPOE is using provider order entry. More than 60% of your medications, 30% of your labs, and 30% of your radiology. That is actually an increase up from 40%. E-prescribing for more than 50%. That is also an increase from 40%. Demographics, we're reporting for more than 80% now. That's up from 50%. Vital signs, once again, that is an increase for more than 80%. That's up from 50%. Now the interventions, I skipped. Smoking status, we're recording smoking status for more than 80%. Interventions, now you're going to implement 5 clinical decision support interventions, plus your drug-to-drug and your drug-to-allergy. That is an increase up from 1. Incorporate lab results for more than 55%. Generate patient list by specific condition. That is now a core objective, where before it was a menu. Preventative reminder. You're using your EHR to identify and provide reminders for preventative or follow-up care for more than 10% of your patients with 2 or more office visits last 2 years. That also is moved from a menu measure to a core. Patient access. Online access for more than 50%. 5 of those have to actually access the information. Visit summaries. Provide office visit summaries for more than 50% of office visits. And we're going to come back and discuss visit summaries in detail. Education resources. This is also now a core measure. You need to use your EHR to identify and provide education, more than 10%. Secure messages, more than 5% of your patients are sending a message to you. RX reconciliation, medication reconciliation at more than 50% of transitions of care. That is also a move from a menu measure to a core measure. Summary of care, provide summary of care document, more than 50% of transition of care and referrals. 10% of those need to be sent electronically, and one of those needs to be sent to a different EHR vendor. Good thing for that is CMS is going to have a test site available. Immunization, successfully ongoing test document to the care registry. Now for my San Diego providers, very important, you may have received an email out from Rob Weston with CARE. You need to answer that. He's telling you that you did a test last year, or you sent documentation saying you were registering for CARE, but you still need to send in your HL7 test. He has put a December 2nd deadline to that. Security analysis. Conduct or review security analysis and incorporate in risk management process. Your menu measures, imaging results. More than 10% of your imaging results are accessible through your EHR. Family history, recording your family history for more than 20%. Syndromic surveillance, successful ongoing transmission of syndromic surveillance data. That's through the CDC. Cancer, once again, that is also through the CDC. The specialized registry is also through the CDC. Those three items are still being built, so if they're not available, then they'll have exclusions for those. Number 6, a progress note. You need to enter an electronic progress note for more than 30% of unique patients. Here is the information on the CDC site. And if you look over on the left under public health options, it has the cancer, the ELR, the immunization, and the syndromic surveillance site. I recommend that everyone go on this site and review that information. It's very important. Closer look at patient engagement. This involves setting up your patient portal. Those of you that have your portal set up where you can send your patient a message, but you would rather not receive a message from your patient, unfortunately for stage 2, that is not going to work. You have to open it up. More than 5% of your patients must send a secure message to you. 5% of those patients that you have in your system must access their health information online. Electronic exchange. This is sending from one provider to another provider. Stage 2 requires that a provider send a summary of care record for more than 50% of transition of cares and referrals. We're going to talk about CQMs. Before you did 6 out of 44, you had your 3 core or your alternates and your 3 menus. Now you're going to choose 9 out of 64. They want you for stage 2 to make sure that you are using measures that are specific to your practice or to your specialty. So if you are a pediatrician, then you should be using CQMs that are pertinent to a pediatric practice. So at this point, everyone's probably going, oh my gosh, this is insane, I cannot do this. You can't do it alone. You have to do it, all of you working together as a team. If you try and just put it on one person, whether it's the office manager or the back office manager or the provider, it's not going to work. Everyone has to work together. Now we're going to discuss in detail right now some challenges that I have noticed that providers are having. One of the very important challenges that I have noticed is the printing the visit summary. What constitutes a visit summary? It's very important that you check with your EHR vendor to see what their minimum requirements are. So what items do you have to select on your visit summary to make that visit summary get counted? CMS has certain rules of what they consider to be minimums. Okay, I'm going to just read a little bit and I'll have Dustin email this out with the program. They define a clinical summary as an after-visit summary that provides a patient with relevant and actionable information and instructions that contain the patient's name, provider, office contact, date and location of visit, updated medication list, updated vitals, reason for visit, procedures and other instructions based on clinical discussion that took place, any updates to the problem list, any immunizations or medications that were administered during the visit, a summary of the topics that are covered, time and location of your next appointment and tests that may be scheduled, a recommended appointment time frame if none were scheduled, list of other appointments and tests that the patient needs to schedule with contact information, recommended patient decision aids, laboratory and other diagnostic test orders, and results if received before 24 hours after the visit, and a list of the symptoms. So, having read that, I know that a lot of providers are not meeting that information. Now, CMS also does say that there is a very minimum of what they will allow you to do. But if your EHR has all of those items that I just read off, then you need to go ahead and select all as your option before you print that out. Moving on to security rule. You have to implement policies and procedures to prevent, detect, contain, and correct security violations. This is very important that this security analysis is done during your reporting period. The documentation needs to show that it was done during your reporting period, not at the time of your attestation or at the time of a possible audit. Data exchange of key clinical information electronically. Get ready for stage 2. Okay, make sure that your EHR vendor has a way for you to communicate with another provider. Document, document, document. I'm going to discuss this a little bit more when we discuss our next topic, which is audits. If you are a Medicaid provider, you are basically doing your audit as you attest for meaningful use, because each measure you have to upload your proof that you have met that measure. Now, if you are a Medicare provider, you go on the site and you attest and you move on and wait for your check. I need everyone to take a step back and before you attest for meaningful use, to make sure that you actually have all of that documentation for an audit. Audits do happen. They can happen up to 6 years post-attestation, and it's very important that before you click that button and you submit under perjury, that you are meeting those measures and that you can back it up. Okay, that's very important. You need to be able to back it up. One of the items they are asking for, part 1 under requested documents, is they request that you have your licensing agreement and an invoice that identifies the vendor, product name, and product version number of the certified EHR system that is utilized during your attestation period. So just do yourself a favor, make sure that you have all this information available before you click that button and attest. You'll receive a letter from the auditors and gives very detailed information. Want to make sure if you need assistance, reach out, get assistance. Physicians Partners has resources. They can get you in touch with someone, but don't ignore it. The deadline is usually 2 to 3 weeks, so make sure that you take care of that. You will see that there are a lot of prepayment audits coming out right now. So you may attest and say, wait a minute, I've never got paid. Go and log into your CMS site, look under status, and it'll tell you if you are tagged for a prepayment audit. Right now, this is all the resources that I've discussed, some great links, and we are done. We'll open it up for some questions.
Yeah, and while some questions are sent in, I just want to point out the links that you mentioned. There's a lot of links. The slides will be going out to everybody tomorrow, so you'll have the link to download this presentation in your inbox tomorrow morning. As far as the recording for the presentation goes, that'll be available on Friday on the new Physician Resource Center website. That's launching actually tomorrow at the showcase event. That Teresa mentioned, all the different downloads, links, resources. We've been talking about developing a meaningful use toolkit. We'll be working with Teresa to develop that page content, and that'll also be on the Physician Resource Center website in the coming weeks. I would say sometime in the next 14 to 21 days we can have that available for everybody to view and to click through. So, but if there are any questions, please, you can use the GoToWebinar interface, type the question in, and we'll go ahead and answer it. I have a question as far as portals go. So I know that some EMRs, their portals can be very expensive, or some don't have portals that are quality integrated. Have you heard of some other portals that are available that offices can use to be able to attest to that measure?
So first off, to meet meaningful use stage 2, you have to use a patient portal.
Well, I guess my question is, have you heard of any portals, outside portals that are available outside of EMRs, ancillary ones that offices can use that maybe aren't so pricey as some of the ones that the EMRs are offering?
I haven't specifically, although I know that there's been a lot of talk of them being developed.
Okay.
But I can look into that more and maybe provide you with some
information. Maybe that's something we can work on for the toolkit when we show it to everybody.
Right.
That's great.
The only problem with something like that is you have to be able to count it on your dashboard.
Okay.
So keep in mind also, everyone, that anything that you attest to, you have to have it counted through your certified EHR.
It has to be.
It has to be counted. So except for self-attestation measures, which frankly there aren't that many this time, it has to be counted on your dashboard or whatever your EHR calls it.
Okay, that makes sense. Well, Teresa, thank you very much for doing the presentation today. We really appreciate you doing this, like the 4th time I think you've done it with our members, so thank you.
You're welcome.
And again, this information will be available tomorrow for download, and then the video will be available on Friday on the new Physician Resource Center website. And the URL for that is physicianresourcecenter.com. All right, everybody, thank you for attending and have a wonderful day. Bye-bye.